The Physician's Road. Create your life in medicine, on your own terms. Today, we are on the path of relationships.
This live Physicians Road is brought to you by Vernonville Asset Management. Vernonville Asset Management was created to help physicians build wealth and create income beyond Wall Street. Through our exclusive private investments, doctors can begin to free themselves from the burdensome regulations in healthcare by creating income streams independent of medicine. Go to incomebeyondwallstreet.com to get your free report, Wall Street's Biggest Lie. Again, go to incomebeyondwallstreet.com to get Wall Street's Biggest Lie and free yourself today.
Welcome to Physicians Road Podcast. Today, we're on the path of relationships. And I'm so happy to have Dr. Dawn Brown here. She's America's favorite ADHD expert. She's double board certified child, adolescent, and adult psychiatrist. She's the owner, CEO, and sole practitioner at ADHD Wellness Center and has 2 private practice locations in Texas. She also has a growing virtual presence offering online appointments. She's a pioneer of the mental health movement and a nationally recognized ADHD coach, public speaker, author, and professional mentor. Dr. Dawn, welcome to the Physicians Road Podcast. Tell us a little bit more about yourself.
Well, thanks, Dr. Tait, for the introduction. So yes, I'm also recognized as the MD with ADHD. And so what that means is that, yes, I also have ADHD. I was diagnosed about 8 years ago in my adulthood. And it's one of the many reasons why I'm so passionate about the disorder, not only managing it with other families, but as well as educating the population and community about ADHD and how important it is to recognize its existence and even more important to manage it.
Perfect. And so we'll probably end up doing a very in-depth podcast on ADHD itself. But in this opening podcast, we're introducing you to the Physicians Road family. I want to really kind of get into kind of a more general topic around parents and parents of affluence and parents who are professionals like ourselves, doctors, dentists, who may have, let's just start on the younger child side of things. If a parent is worried that their child may have something, whether it's autism or ADHD or some kind of behavioral, I don't like to call it a disorder, but just some kind of behavioral, let's just say disturbance. Mm-hmm. Walk them through what they should be doing, when they should be seeking professional help, any signs and symptoms. And you can do it by age bracket if you want. Again, you're the expert. But we really just want to give people an understanding and a sense of reassurance about when they should be reaching out for professional help, even though we're all professionals ourselves, oftentimes in medicine.
I think that's a very good question, a very important topic to discuss because it's a common question that I often receive from parents and families. I would suggest that as a parent, you know your child the best. And so if you recognize certain things that are not necessarily a part of their normal function or natural functioning, then yes, it's a time to ask questions. Typically that starts with the pediatrician. Sometimes it starts with professionals such as myself as a child psychiatrist. But normally I would tend to see kids as young as 4 or 5 years old. Okay. And that is usually the age, of course, where they actually are around other kids. They go to preschool, Montessori, so that's a time where a lot of teachers may actually suggest some concerns because they're in the social atmosphere. And of course, many kids don't get that one-on-one attention. And so that's where they start to recognize some social disturbance if they're talking when teachers are teaching or when they're trying to remind them to sit down in their seat. So that's usually age around 4 or 5. But I more commonly see kids around 3rd grade. And this is a really interesting time frame, mainly because we connect it to the state testing. So, 2nd to 3rd grade is a course, educational course where a lot of kids are really advanced and trying to make up a lot of work in a small amount of time. Teachers are trying to prepare their students for the state test, the first one, which is in 3rd grade. And so, the amount of instruction that they receive is a lot, and they're trying to cover a lot of subject areas, again, in a short amount of time frame. So I see a lot of kids in 3rd grade. But when you start to recognize that your child requires more reminders to complete tasks, more redirection, if they're becoming more forgetful, misplacing certain things, if they are above their level of activity. And then again, I don't want to, stereotype this, because kids are kids and they're very energetic. They're very curious, very curious minds. And also they're very impressionable. And so if they're in environments where they're very stimulated, of course, they're going to respond to that. But if it's interfering with their functioning, if they're around people in school and you're hearing from teachers commonly state, very social kid, but, he's talking when I'm talking, or he's talking to his classmate when I'm trying to teach, or he's getting him out of his seat without permission, he's walking out of class. Those are the type of comments that I often hear teachers report. Okay. And at home, again, reminders and having to do things over and over again. And that's, unfortunately, the kids are getting into trouble for certain things outside of their control. That's when I'm concerned about executive functioning disorder, such as ADHD.
Got it. And so is there a particular pathway that parents should take? Should they always be going through their pediatrician? Should they be trying to call you directly? I know some of this is going to be insurance mediated, whether or not they have to get a referral and those kinds of things, but do you have a thought process on that?
Yes, very insightful. Like you're saying, insurance mediated, of course, because not many insurances offer mental health services unless it's requested. So commonly, I actually hear that parents come to me because they've met with their pediatrician first. A lot of my colleagues who are pediatricians feel very comfortable and are very professionally experienced in starting management at first, diagnosing ADHD, for example, or autism. Usually autism is referred to a developmental pediatrician or another mental health provider that is clinically trained. It's not easy to diagnose that. It's not, you just can't just complete a clinical exam and say, yes, your son or daughter has autism. It's actually an extended process. So is ADHD. But if there are concerns, pediatricians will start the process, or they would actually, initiate the process and start treatment. And to a certain point, they may continue. And then when it gets to a point where they're just, need more professional advice from a specialty provider such as myself, then they will refer to me. On the second hand, there are parents who start the process with me as well. And so, yes, it's insurance mediated, it's availability, that is also a concern, because there's not many child psychiatrists that parents can get into within a quick time frame. But I try to make it convenient for parents by offering telepsychiatry appointments as well as in-office appointments.
Oh, perfect. Well, you are on the cutting edge if you're able to do the telepsychiatry as part of your menu of offering already. And I'm going to give you a full chance to run that commercial at the end about your services and everything. So let's talk about now on the emotional side. Let's put your adult hat on for a second, and let's talk about the role that denial and shame might play from the parental side of having a child that may have some type of developmental process, let's just say. What do you see, and what can you give to parents to reassure them that they are not alone in potentially feeling these feelings?
Yes, great question again. And so I actually mediate a mom's group, and this group is basically to help nurture, to help support, to be an advocate for moms who parent children with ADHD. I'm actually mentioned that because we talk about that. We talk about the shame, we talk about the guilt. Many moms and fathers, or any other parental figures, grandparents, for example, they often mention that they feel like a failed parent or a parent role, that they failed their child. If there's anything they could have done differently when they were pregnant, or anything they could have done differently to rear their child in providing, any nurturing environments, foods, and I say, no, this is a disorder that's outside of one's control. There's nothing that you could have done differently. It's particularly if I'm talking about ADHD, it is the most common mental health disorder diagnosed in kids, 6.5 million kids. And it actually progresses to adult, years, 10 million adults average have it. But if you also talk about other neurodevelopmental disorders such as autism, we really don't know what causes these disorders. We really really don't know what causes ADHD. We have an idea of what impacts it. So environmental stressors, genetics, high predisposition and within genetics. So if a parent has ADHD, 50% chance that their son or daughter would have it. Same type of resemblance within siblings. Concordance rates about 50% as well. And so we still don't know. We have an idea what causes a person to have high blood pressure, by their risk factors. When you talk about ADHD and other neurodevelopmental disorders, there are risk factors. We just don't know what causes it. So that hopefully alleviates some of the guilt, some of the shame, knowing that it's the most common disorder. So, it's not your fault. I mean, there are many other parents in your role, there's similar experience as you. And I also am an adult version of their children. And so having ADHD, I try to have a therapeutic alliance and connection with them and express to them, hey, my mom didn't know. My father didn't know. I wasn't diagnosed until 8 years ago. So I think that at the time of management, I tell them, hey, you can have a day. Of course, they don't need my permission, but you can have a day of trying to figure things out and having a day of saying, this is not my fault. But guess what? We need to live in the moment. Let's go ahead and position your child to win. Let's talk about what we can do now and how to prepare them for a future, because that's what's important. And there's a reason for everything, and so it just adds value to the topic. It adds reassurance to the parents that it's not their fault. Okay. So hopefully that alleviates all of those, guilt, shame, fear, those type of feelings that naturally a parent would feel. And I would be concerned if they weren't concerned. So can you give some examples off the top of your head in terms of how you lay out kind of plans for I'm not trying to let you give away any trade secrets, but what does that look like? So if a parent is worried about one of these developmental processes, do you lay out a vision of the future for them? What does that kind of look like? Can you go into that just a little bit? Just give folks a little bit of taste of that. Sure, I definitely do, because it's a part of the treatment plan, not just to prepare them for, okay, for the next few weeks, this is what we're going to do. But as a teenager, expect these things. As an adult, expect these things. So for ADHD, because that's my specialty, I suggest this is a lifelong condition, even though different forms of literature may say 50-70% of children may actually still have the disorder and try to manage it as an adult. And it's different levels of severity. But I believe, and many of my colleagues believe, that this is a disorder that is lifelong. It's just that we're able to compensate for deficits. And so that's what I try to actually have them do, is position their child to win, knowing what their weak areas are, help strengthen them. And then, for some kids, for example, small group settings may be the best type of educational experience for them. And so if you have that versus being at a large university, they're more likely to excel in small group settings because they have that one-on-one experience. That's how I excelled at Xavier University of Louisiana, right? And so it's so important that we talk about the lifestyle. And that's what, I know we're going to get to it at the end, but that's what my programs offers, is that we talk about the lifestyle. And that's so important, not just to hit on medication management, but what their meal planning should be looking like. What are the best fuel sources for the brain when you have a neurodevelopmental disorder, as well as activities. So that's important.
And if you want to go into it now, this is perfect.
Oh, okay,
if you want to go through that, go right ahead.
Yeah. So, as far as a neurodevelopmental disorder such as ADHD, I actually offer an 8-week program. It's called the Total Optimization ADHD Lifestyle Program. And currently I offer it for children. This program talks about meal planning. It focuses on different routines. Homework routine, bedtime routine or sleep hygiene routine, all right, school routine, waking up routines. I mean, these are the type of struggles and the stressors that many parents experience when their child has an executive function that has really no capacity for time management. It's hard to recall different things. And so I offer a program that uses all types of or different parts of the brain so that it can position their child to win, and making sure that they require less reminders, that they're not forgetting their instrument at home or their lunchbox at the kitchen counter, and their parent has to run home or provide them meals at school. I mean, this is like an everyday type of happening for many parents who have children with ADHD. And if you talk about other executive functioning disorders like dyslexia, which is commonly associated with ADHD, there are different types of support systems that the school can provide, different types of resources that parents can utilize at home to help their dyslexic child. Autism spectrum disorder, another lifelong executive neurodevelopmental condition that actually affects social skills, communication skills. These kids tend to sometimes not really grasp the nonverbal cues. And so they need these type of social skills or social skills training in order to make sure that they are viable and vital citizens, in society too. So we talk about the lifespan. We talk about what it's going to be like to go to school, what type of school they're going to attend, what type of activities like karate, which is the best form of activity for any child who has oppositional defiant disorder or ADHD or autism. It teaches levels, achievement. It is a peer related activity. It teaches discipline because they have to, agree and respect their master who's teaching. And it just allows for them to have self-worth because they're progressing through with the color belts. I mean, that's my most common recommended activity, and it gets that heart rate going as well. So yes, we talk about all aspects, and this is a very valuable tool program that none of the psychiatrists or any other individuals offer, but I know what it's like because I live with ADHD. So that's what I tried to take. I tried because I did karate, I did music, I attended a small university, and I've succeeded in my life's achievements. And so I want to give that to other families so they can also benefit from it as well.
So we could call that you lived your creed.
I lived my creed. That's right. That's right. And it's a superpower. I know you refer to it, Eric, as a disruption. I appreciate that we're knocking off the disorder part. Of course, we describe it as disorder because that's what people are going to read about. That's what they're going to associate it with. But when you think about it and you're managing, particularly ADHD, it is a superpower. It doesn't put us above anyone. I say superpower in context of that person's ability to achieve. And so it's not a thorn in my side. As long as I know how to manage it, I'm so creative. I'm very intelligent. I'm a scholar. I'm an author. I mean, I'm an achiever. And it has nothing to do with, me boasting. It has everything to do with me experiencing failures in my life, not knowing that something such as ADHD interfered with my ability to see, and now realizing that, wow, I'm at the top 10% of my profession, based upon this disorder and managing it. So, that's why I'm so passionate about it. And I'll speak all day about it if you like. So
listen, it comes through as a mentor of mine likes to say, you can hear it in your music, meaning the way in which you were speaking, the way in which you were talking about it. And so let's give me 30 seconds on how having ADHD has helped you.
It's helped me in relationships. It's helped me to communicate to my significant other. These are certain of my idiosyncrasies that may be part of my personality, but this is definitely part of my ADHD. So my significant other is so awesome. And having those conversations with him allows me to be at my best, because now I'm not concerned about him because we're so caring people as well. And, part of our disorder is that we know we need reminders and we need structure. And so that actually helps our other family members provide. So if a mom has a child and she's, helping with the, structure their child's life, everyone in that family is getting on board with their own structure, task list completion. It's so helpful with everyone. So, that's helped. It's helped in my profession, of course, is being having ADHD, and it's connected me with families and individuals who may not necessarily have believed in mental health disorders, and now identifying, wow, this is something that is outside of my control, that now I understand that I have objectively, and now I can trust that I can manage this and be successful. And so that has been a huge gratification type of tool for me, that to see that other people are realizing success and achievement when they came to me, complaining of failures and not performing at their optimal best. It's helped me in my own self-esteem. I did not know why I was struggling in medical school. I mean, I actually failed boards 5 times, and I actually expressed that. And I'm a good doctor, okay? Don't get me wrong, but it was ADHD that interfered with that. And so that's why I say I was at the top 10%, because I had to take boards after my child fellowship, and it was 4 years of boards, and I scored at the top level all 4 years. So for me, it went from failing to succeeding. And so, I discussed that in my book that I'm releasing in a few weeks as well, is that this is a disorder that can interfere with school. It can interfere with relationships. It can interfere with your career. It can actually lead to other risk factors such as drug and alcohol use. It can lead to divorce. I mean, these are the risk factors that are well known about executive functioning disorders such as ADHD.
Okay, perfect. Well, that's a great encapsulation of everything. And the big takeaway that I've gotten from you is routinization in terms of, and structure are huge things that need to be put in place. I think for all children, but especially in and around these types of developmental processes. So let's switch gears a little bit, and let's move into a little bit older age child, maybe. And again, you see this in your practice. You can kind of tell me where the breakdown is. I know with my wife and I, we're both physicians. We make more money individually than our parents probably made collectively. And so we're raising children in a way that is a little bit different than we were raised, not necessarily in terms of discipline, but just in terms of material wealth. And I know, and I'm in a lot of doctor groups, there is a lot of angst around raising children of privilege and of affluence, and fear around behavior in that process. And so, again, I'm not an expert, so let's just talk about some of the emotional issues that can affect children of affluence in terms of what you see. And then we'll move into how do we guard against that? Or if we have those issues, how can we fix that in our own children?
Yeah, I try to normalize a person's experience. Majority of my patients are from the communities of affluence. And so that's predominantly of the patient population that I serve. And then I also have the opposite end where I serve individuals who are not insured. So I see the difference. And this is a great question to bring up, because there are certain differences within each community. When you talk about members of affluence, of course, like you talked about the accessibility. So the availability of having teachers there, the availability of having private schooling, the availability of coming into appointments whenever you can, especially if you don't require insurance. I mean, the need of to be gratified in a certain time frame is there when you have the resources. I mean, that's just how it is, right? And so sometimes that masks certain complications and challenges that our children and even our families are facing. So you're not necessarily going to see the common symptomatology that may be presented. For example, depression. Very common in our society. I see it more common in the communities of affluence than others, because I know what to look for. So some kids may be excelling in school, grades, all A average, doing great on this football team. But when I have them one-on-one in my office, they might have said they were suicidal. And their parents would not know, because sometimes the look on if a person or a child is achieving is basically by their productivity, but not by communication.
Okay, so let's go. So let's go there. So what should parents be watching for?
As a parent, instead, if I could, if you will, instead of watching, and I'll definitely answer that question. I would actually say start by communicating with your child. Okay. How do they feel? Talk about emotions. Talk about feelings, because sometimes kids are not going to express it as we want or as we would know how they would express it. Usually when someone is sad, they're crying. But these children, and I see it more commonly in communities of affluence, they're not going to show it. They're going to talk about it through communication if you ask. And usually they're going to talk about it unsolicited with their peers.
Is there a way that parents can ask to get more? I mean, because especially if you have teenagers, and I don't have any, but we see all we see all the usual angst around teenagers and them shutting down.
Right.
Is there a way, or do you have to cultivate that from a younger age, or how do you navigate that?
Great question. It's great to cultivate that from a younger age because you develop a routine in cultivating it. It's not pretentious. You're having your mom and daughter moments and they're happening every day, just a 5-minute conversation. How was your day today? Like, for example, I've recommended for parents to talk about one great thing that their child did and one not so great thing that they're struggling with, and have that question every single day, to start that conversation where it becomes a part of their routine, where the child is actually talking to them about their day and they don't have to ask. Okay. So it's great to cultivate that, but it's never too late to start cultivating that either. Having the discussion, hey, listen, for example, I had a family come in the other day and their teenager is addicted to, gadgets, social media. Mm-hmm. And that's how they communicate. Now, part of it is because he has a communication disorder, like he has autism spectrum disorder. And so many of his friends are online and he doesn't have good communication skills. And we're working on developing those. But one way that he communicates through music. So what he's doing is actually playing a song to them to express his emotions where he's not able to vocalize them.
Oh,
you have to meet your child where they are, and your child is still a child when they're teenage because they're your child, right? Yeah. So see what they're involved in, and I'm not suggesting that you become the child and they become the parent. What I'm suggesting is that we're making different connections that we were making when we were children and our parents were our parents, because the game has changed as far as involving technology, as far as involving how fast the world is paced. We're not sitting around the dinner table and having these type of discussions, right? Not commonly, and so that's where we fail. That's where we don't get to have these awesome discussions where we, talk about conflict resolution and resolve certain things that they're experiencing. So we have to make room for them. And so if you're picking your child on the way up from school, have the conversation. If your child is 18 and they're still living at home, have the conversation, over dinner, over a bowling game. Have them though. It's so important that we incorporate that time. Okay. And so I would say that's definitely number one. Number one.
So communication is the big driver of this, and communicating in a way that is at their level, meeting them where they are on the communication level, but you don't cede your role as parent in the process. Would that be
yes? And one final thing I want to make, Dr. Tait, with this is because social media has disallowed the soft skills to be identified that we're so used to in our generation. What I mean by soft skill are the nonverbal skills. When you go to a fast food restaurant, with the exception of a known Chick-fil-A restaurant, I'm not gonna get permission from them, but if you were to go to some other restaurant where they don't say good morning and God bless you and how was your meal and would you like anything else? I mean, I've actually went to like 3, and I actually did a small study. When I go to these places where it involves a lot of teenage employment, who is going to say hi to me? Who is going to engage eye contact with me? Who is going to notice when I'm not satisfied with my meal? Who is going to notice this? And I will tell you, 9 times out of 10, the teenagers didn't notice, and it's not their fault, but it has a lot to do with maybe upbringing, but a lot to do with things like these gadgets and how they're communicating even with their friends. I mean, I have a family of 4 and they communicate text messages while they're in the home instead of, engaging. And so we're working on that. So, just to give you some ideas of, it's just so important. We're getting away from it because we have the introduction of technology and how that can disrupt it. But we need to get back to old school in communicating with our family members.
So sitting around the table and talking about each other's day and how everyone is feeling is a noble outcome to shoot for, I guess.
Exactly.
Okay.
Exactly.
Perfect. Well, time is running, and I know people's attention spans can wane. So what I want to do is there anything that I didn't ask you that you would like to communicate kind of in your introduction to the Physician's Road, and what you would like to communicate to others, and then tell us about your practice and where people can find you?
Definitely. Having a mental health disorder is definitely not the end of the world. I believe that just like any other medical condition, having a mental disorder is just as important to recognize if you have a mental health disorder and then therefore make sure that it's managed appropriately. And it can be as simple as managing someone who has high blood pressure or even the flu. And it could also be as simple as just suggesting that, listen, this is the problem that I'm having. So I actually recommend starting with your family member. If you think that something is off, even with your child, have those open discussions with your family member, and together you all can actually seek out providers such as myself, and I'll give you my information in a minute here, because I welcome you. And I don't treat everyone that walks in my office, because everyone that walks in my office doesn't necessarily need treatment. They just need direction, and they need reassurance of what's going on. And so that's what my role is. And so it's okay. I have a mental disorder. I'm functioning, and I'm thank God that I identified it, because it has definitely been a life changer for me for all benefits I've mentioned in our discussion today.
Perfect.
Okay.
And so now please give us your commercial.
Yeah, so listen, Dr. Dawn, Psych MD, your most influential double-boarded child, adolescent, and adult psychiatrist. I help moms and their ADHD children champion their ADHD. So through my speaking events, my book series, upcoming book series, I'm having my first book launch on April 17th. Please look out for me on all social media avenues at Dr. Dawn Psych MD. That's DRDAWNPSYCHMD. You can go to my website, drdawnpsychmd.com. You can find me in Houston, Texas. I actually have an office that you can see, and also provide telepsychiatry in the states of Texas and Illinois, where I'm licensed. So I would love to help you and your families. And not only do I see people with ADHD or suspected ADHD, but I also manage disorders such as autism, spectrum disorder, Tourette's disorder, oppositional defiant disorder, anxiety, depression. So, these are the common comorbidities that we also associate with ADHD. So I would love to be a part of your family.
Perfect. That's boy. You are well trained, boy. You nailed that one.
Thanks, Dr. Tait. I appreciate
Absolutely.
that.
No, thanks to have you on. Again, we'll have you on, and we'll probably do deep dives on specific disorders in the future as well. So I just want to give people a quick overview of kind of who you are and your expertise, because I've been impressed with you and your cohort and what you're doing, and we want to do as much as we can do to support you out there. So, and
God bless you for what you're doing. We need more Dr. Taits. I mean, what you're doing is phenomenal. It's accessible. It's entertaining as well as educational. And I think that these are the type of things that we need to do more of. So I really appreciate this opportunity to be on your show, and I appreciate the support that you've shown me as well. Thank you so much. I mean, it just benefits the population. I think that's what we're both about as well. I know that's what we're both about. So, and that's both our mission. So I appreciate that.
No, thank you so much. And so I want to thank Dr. Dawn Brown for being with us today on the Physicians Road on our path of relationships. Please go to iTunes, Stitcher, or your podcast medium of choice, and please write a review. 5 stars is best because it helps us rank higher so that more physicians can find us. But please, of course, do an honest review. And please check out our Facebook group on Facebook. The Physicians with an S Road on Facebook, and join us there, where we go through the different paths of relationships, practice, wealth, personal development, and health. And so thank you again for joining us on the Physicians Road. I'm Dr. Eric Tait.
The Physicians Road is brought to you by Vernonville Asset Management. Vernonville Asset Management was created to help physicians build wealth and create income beyond Wall Street. Through our exclusive private investments, doctors can begin to free themselves from the burdensome regulations in healthcare by creating income streams independent of medicine. Go to incomebeyondwallstreet.com to get your free report, Wall Street's Biggest Lie. Again, go to incomebeyondwallstreet.com to get Wall Street's Biggest Lie and free yourself today.
Thank you for listening to The Physicians Road, where you create your life in medicine on your own terms. Please go to thephysiciansroad.com and sign up for your free guides and resources.